Sex can play an important role in your health and overall quality of life. Cancer and cancer treatment may impact your ability to have or enjoy sex during or even after treatment. If you're struggling with your sex life, know that you are not alone, and your healthcare team is available to help you manage any problems related to your sexuality. While it is important to discuss how your cancer treatment might impact your sexual health with your healthcare team, this video will help you identify common sexual health changes that may result from cancer and cancer treatment. Learn different ways to manage these sexual health changes and feel more confident asking your healthcare team any questions about your sexual health. Please note that this video is for all people with a vagina, regardless of your gender identity. If you have a vagina, this video is for you. Let's begin by addressing some commonly asked questions. Question number 1. Can I be physically intimate during treatment? Absolutely. It's common to feel scared to touch or to be touched during cancer treatment, but there's no reason to be. Physical touch can be therapeutic and help maintain intimacy in relationships. During treatment, it is common if you don't want to have sexual intercourse. In this video, sexual intercourse refers to penetration into the vagina or anus. But being intimate is so much more than just sexual intercourse. It can include oral sex, masturbation, kissing, sensual massages, or cuddling. These activities can all be performed safely as long as you're feeling up to it. If you do want to have sexual intercourse, you might need to take some precautions. It's important for you to understand why. Let's get into some anatomy. The inside of your vagina and anus are lined by a thin layer of moist tissue called mucous membranes. During sexual intercourse, friction against this moist tissue can let bacteria into your bloodstream. Normally, our bodies can fight these bacteria so they don't cause infection. But when you're going through some types of chemotherapy, there are fewer infection-fighting cells in your body, so your chances of infection may be a bit higher. Your chemotherapy may also cause a low platelet count, which means intercourse could cause bleeding. So you might be advised to be gentle during intercourse. Use a lubricant to reduce friction or to not have intercourse at all during your treatments. Just ask your healthcare team for guidance, since they know your situation best. But remember, no matter what, touching is always okay. Question number 2. If I'm receiving chemotherapy, will having sex impact my partner's health? Very low levels of chemotherapy can remain in your saliva or vaginal discharge for 48 hours following treatment, but there is no evidence that this is harmful to your partner. With that said, it is still important to consider some kind of barrier, like a condom or dental dam during intercourse or oral sex during this time. In fact, we strongly recommend the use of barriers throughout cancer treatment to avoid getting pregnant or acquiring STIs. Question number 3. Can having sex give my partner cancer? No, you cannot catch cancer from a sexual partner. Question number 4. Can I discuss my sexual health with my healthcare team? Yes, feel free to ask any members of your healthcare team any questions you have about your sexual health. It's part of your healthcare provider's job to talk to you about sexual health, so don't be shy. Now, let's talk about some common sexual health changes you may experience. Some changes are temporary and go away once treatment is over. Other changes may be long-term and remain even after treatment is over. The cause of these changes may be due to chemotherapy, radiation therapy to your pelvis, surgery, or hormone therapy. While the causes may be different, the resulting changes may be similar. Here's why. Menopause occurs when your ovaries stop releasing eggs and when you don't get your period for at least 1 year. Menopause normally happens between 45 and 55 years of age. This process involves a gradual decline of your hormones called estrogen and progesterone. But when getting treatment for cancer, you might begin menopause prematurely and suddenly. The rapid reduction in estrogen levels can have a significant impact on your sexual and vaginal health. The symptoms of premature menopause are more severe and intense than those experienced during natural menopause. These symptoms include vaginal dryness, vaginal atrophy, which is when the lining of your vagina becomes thinner and less elastic, pain during intercourse, decreased desire to have sex, and difficulty with sexual arousal. If you lose the desire to have sex, know that it is completely normal and nothing to feel ashamed of. Aside from changes in your hormone levels, there are many other reasons why you may feel this way. You might be uncomfortable with changes to your body. You might feel stressed, anxious, sad, or depressed. And you might have uncomfortable side effects from the treatment or cancer itself, like fatigue, nausea, or pain. Now that we've talked about the challenges you might face, let's show you different ways to manage these problems. Number 1. Vaginal moisturizers. If you're experiencing vaginal dryness, vaginal moisturizers can help keep your vaginal lining moist and healthy. You should apply it regularly, around 2 to 3 times per week, preferably at night for best absorption. These moisturizers can be applied to the inside of your vagina or to your vulva, which includes your inner and outer labia and clitoris. Increasing the moisture in your vagina can make sexual touching and penetration more comfortable. Moisturizers can all be purchased over the counter at your local drugstore or online. Number 2. Vaginal lubricants. Using lubrication can make sex or masturbation feel better. When it comes to finding a lubricant, look for brands that are free of perfumes, coloring, or chemicals, as they can irritate your vagina. Lubricants can be applied before any sexual activity, either inside and around the entrance of your vagina, your partner's fingers or penis, or on sex toys. There are 3 types of lubricants available: water-based, silicone-based, and oil-based. Here's what you should know about each one. Water-based lubricants can be used for any kind of sexual activity, are safe to use with condoms and sex toys, but dry out faster, requiring frequent application. Silicone-based lubricants have a slippery and thick texture, last longer, requiring less frequent applications, are safe to use with condoms, but cannot be used with sex toys or dilators made of silicone. Oil-based lubricants have a slippery texture, last longer, requiring less frequent application, are a great option for sensual massage and sexual activity without penetration, but cannot be used with latex condoms or latex-based sex toys and may increase your risk of vaginal infection. If you are wondering which lubricant to choose from, just ask your healthcare team for guidance. You may need to try different kinds to find out which works best for you. Lubricants can be purchased over the counter at your local drugstore, sex shops, or online. Number 3. Local estrogen therapy. If using vaginal moisturizers and lubricants does not improve your vaginal symptoms, your doctor may suggest local estrogen therapy. This therapy involves putting a low dose of estrogen directly inside your vagina, making it more moist and stretchy. The estrogen comes in different forms: creams, insertable tablets or capsules, or rings. Be aware though, vaginal estrogen may not be a suitable treatment if you have hormone-sensitive cancer, such as breast or ovarian cancer. So ask your doctor or nurse if this option is right for you. Number 4. Vaginal dilators. After certain cancer treatments like radiation to the pelvis or pelvic surgery, your vagina may become drier, less elastic. narrower, or shorter. Your healthcare team may call this vaginal stenosis. Vaginal dilator therapy can help manage these changes. A vaginal dilator is a flexible cylinder that is put into the vagina to stretch the tissues. This device may stop scar tissue from forming, increase blood flow, and keep your vagina open. This can make sex feel more pleasurable and make gynecological exams more comfortable. Your healthcare team will advise you exactly when and how to properly use a vaginal dilator. Number 5. Pelvic floor therapy. The bottom of your pelvis is called the pelvic floor, which has many muscles important in sex. Pelvic floor therapy is done by physiotherapists who have specialized training in pelvic health. Just like physiotherapists can help restore the function of muscles in the rest of your body, they can also help you learn how to strengthen or relax the muscles in your pelvis to make sex more comfortable or more pleasurable. Pelvic floor physiotherapists can also teach you how to properly use vaginal dilators. You can ask your doctor for a referral or contact one yourself. Number 6. Psychosocial support. Cancer and treatment can negatively affect your mood, confidence, and overall self-esteem. Poor mental health can prevent you from enjoying your sexuality and sex life. Just know that there are many ways to get support: counseling, peer support groups, and medicine if needed. So talk to your healthcare team if your emotions ever become too much for you to cope with. Finally, let's look at some other strategies that can enhance your sexual health. Explore your new body and engage in self-pleasure. Be open and honest about how you're feeling with your partner. Take your time with foreplay to increase your arousal before sex. Be open-minded. If you're in a relationship, there are many other ways to feel intimate with your partner besides intercourse. You can explore ways to be intimate with your partner and experience pleasure just through touch alone. And finally, indulge in self-care. Do things that make you feel good and confident. A diagnosis of cancer does not mean an end to your sex life. We hope by now you have a good understanding of some sexual health changes you might face, and more importantly, ways you can manage them. Remember that your sexual health is important, and you should always feel comfortable discussing it with your healthcare team. For more information and resources on this topic, please visit the Adolescent and Young Adult Program at Princess Margaret Cancer Center website, linked in the description below.